Your love is one of a kind. Your ring should be also. Veragio diamond engagement rings are designed with European elegance, unlike any other ring. Mervis Diamond Importers is the premier source for Veragio bridal rings and for the world's most brilliant diamonds, because your forever deserves extraordinary beauty. Our experts will guide you to the perfect engagement ring paired with a diamond that sparkles forever. Your ring should be as unique as your love story. Mervis Diamond Importers for Veragio rings and world-class diamonds. See us on mervisdiamond.com.
Welcome to the Medical Nursing Podcast, the go-to show for vet nurses and technicians passionate about internal medicine. I'm Laura Jones, a registered vet nurse, all-around medical nursing nerd, and your guide to breaking down complex medical diseases into simple, actionable chunks. Each episode is packed with knowledge and tips that you can start using right away to give even better patient care. So let's get started. Hello and welcome to another episode of the podcast. You are listening to episode 115 of the Medical Nursing Podcast, which is the podcast where we come together to make nursing medical patients simple, even if it's 2 o'clock in the morning when you're juggling a full ward by yourself. Now, I am recording this episode on what is currently the hottest day of the year so far. I have worked some of the bank holiday weekend doing some busy ward shifts, also did some impromptu night shifts. I filled my cup with lots of nursing and enjoyed the air conditioning that was in the hospital. I took a few months earlier this year where I didn't do as much clinical work, some of you guys will know, because my lecture commitments were absolutely wild and there was no way that I could do both without burning out. And let me tell you, I cannot say how much I missed clinical work. I did not realise how much my soul needed that, as well as speaking, to feel any kind of satisfaction in my career. So, after a couple of weeks of filling my cup with lots and lots of nursing, with my passion for nursing fully refueled, and off of the back of Veterinary Nursing Awareness Month, where we, of course, chatted all about how nurses can do more, today what I want to do is continue that by not just telling you how nurses can do more, but showing you what happens when we get to do more. Now, I am very aware that I work primarily as an RVN in referral. I do some GP work, but very, very small amounts versus the referral work that I do. And this means that there are differences, of course, in what I do in referral versus what I do in general practice. However, that being said, there is one thing that remains the same regardless of the clinic that I happen to be working in that day. I still get to use my skills with medical patients. And this is an important distinction that I want to make because internal medicine sounds fancy, but it just means medicine. The internal in front of it doesn't make it more complicated. It doesn't mean it only just happens in referral centres. The truth is that we all see medicine every single day. I was nursing patients with chronic kidney disease, diabetes, dealing with dyspnoeic cats, diarrhoea dogs, etc. way before I went into referral. So if you are thinking that there is less that you can do with your patients because you're in general practice, I really want to challenge that thought today. In this episode, I don't just want to tell you what to do. I'm going to show you. And to do that, I am bringing you the real in-clinic stories from the nurses and technicians that I have worked with inside the Medical Nursing Academy. Now, we're talking over 200 nurses here over a period of 3 years. And what I've done is gone through all of the stuff that they've shared, the wins they have logged, the skills they've been using to show you what's possible. Because these nurses have all done things that they should be incredibly proud of. They've helped their patients in new ways, they've changed their clinic culture, and with that they have also indirectly helped the rest of their nursing team develop and cultivate their passions as well. It does not matter where you work, and I really, really want you to remember that. You can still use more of your skills and make even more of a difference to your patients, your clients, and your colleagues, regardless of the practice you're in. So grab a cuppa if you haven't got one already, or maybe an iced coffee today because I am literally melting in my office right now. And let's talk about how to do that. One of the most common things that I hear from nurses who want to do more is that they don't get the chance to because they don't see many inpatients. And I have been there because I trained in a branch clinic. It was a very small practice. We did not have very many inpatients at all. And also, shortly after this, I spent some time working in a clinic that was located within a pet store where overnight patients could not be hospitalised and they went to an out-of-hours provider. Yet there are so many more ways that we can support our patients than just inpatient care, quote unquote. The thing is, it just takes a bit of creative thinking, and it also takes the confidence to speak up for yourself and suggest new ways of doing things. And one way that we can do this, and yes, I know I talk about this a lot, but it is important, so hear me out, is through nurse-led clinic support. We touched on this back in episode 110, where we discussed quality of life and the role that we play as nurses and technicians in advocating for it. But even if you hate consulting, this is an area where we can make an enormous difference, and it's really rewarding. And I say this as someone who used to hate nurse clinics with a passion. In my last general practice hospital, I was in my element on an ops shift. Put me on diagnostics, even chuck me in a theatre. Now that's something that I didn't think I'd say as a medicine nurse. Give me an anaesthetic. That was where I felt home. I did not particularly enjoy things like post-op checks, dental checks, weight checks. And to be honest, on some level, I spent quite a lot of my time worried that I was giving the wrong advice. So if this clinic hater can think differently about them and see them for what they are, which is just a different way to care for our patients, then so can you. Clinics are also one of the areas that I have seen my community champion the most. I have seen several nurses go to their vet teams with suggestions for implementing medical clinics, particularly for patients with diabetes and chronic kidney disease. These nurses, at least 4 spring to mind immediately off the top of my head, all work in different general practice clinics. None of them are in referral. They all created protocols. They put together proposals outlining why their practices needed to offer these clinics, and they took that information to their team. With an idea, passion, support, and the desire to use their skills differently, their patients now have hugely improved access to nursing care, even if they are not sick enough to be admitted to the hospital. One of those nurses now has over 50 diabetic patients that she's seen for clinics over the past 3 years. Another began by doing the diabetic discharges for their practice, and then had those patients come back in to see them for ongoing consultations alongside the veterinary surgeon. Since then, that has expanded well beyond diabetes, with them now running things like quality of life support clinics for many patients. Another RVN created an entire promotional campaign for senior pet clinics to improve detection of diseases early. And this is important because when we think about things like chronic kidney disease, those conditions are often diagnosed late when time is of the essence, because the more time we have, the more we can slow down progression of the disease. So if we can get seniors coming in and nurses can play an important role in picking up those diseases early, this is going to massively benefit chronic disease patients. And another nurse developed both thyroid and CKD support clinics, working with her vets to increase the support provided for her senior cats. And undeniably, the benefits of this are huge, and they're not just benefits to the patient. Every single one of the clients that those nurses see knows those nurses by name. They know the skills, they know the knowledge that they provide, and they know the value that they have, and they value their expertise in helping them and their pet. And given that in the not so distant past, most people didn't know what veterinary nurses did and didn't see us because we were out the back all of the time, this is huge. Perception and the importance of our role will not change if we aren't out there confidently showing clients just how much we can do and how much we know. And the reality is we are just as important as any other member of the team is that's caring for that patient. Clinics give our patients another layer of support. They help our clients feel supported, they improve access to treatment options that work for them, they allow us to spot subtle changes because we truly know our patients and we know what's normal for them, and they help our vets to manage these complex cases without feeling like they are shouldering all of the pressure alone. Even if you dislike clinics, I am willing to bet that I could change your mind with medical patients, because I promise you they're not boring. They are relationship building and they are incredibly rewarding ways to make a difference. And if you don't have this in your practice yet, but you want to start, please know that you don't need to start with something big or fancy or complicated. All you need to do is pick a condition that you're interested in, pick one where you feel like your patients would benefit, then speak to your vet team and build it out from there. Another area that I feel especially passionate about, and one where I've seen so many nurses champion, is improving clinical standards. Every single clinic can find ways to improve things, even the best ones. So by me talking about improving clinical standards, please don't think I'm saying that clinics are bad for needing to improve. Every single one of us can improve what we are doing every single day, even on a good day. And ongoing auditing and clinical improvement, moving away from the dreaded "we've always done it that way" to more of a data-driven approach, is absolutely essential. And it's also an area that I think we are instrumental in as veterinary nurses and technicians. Because if we think about it, we're the people who are in the ward, spotting when things could be improved or done differently, or feeling perhaps some of the frustrations that come with challenges in delivering care. We're the ones who are trying to get inappetent patients to eat and feeling like there just must be more that we can do, or we're trying to warm recovering patients and wondering if there are ways we can improve perioperative temperatures. So it just makes sense that we champion this, and when we do, our patients benefit significantly. And I have seen several nurses in the community do this in different ways. One of them ran a detailed nutritional audit that actually earned her an RCVS award. And I know that I bang on about nutrition a lot, but the reality is if our patients don't take in enough calories to heal, they end up in hospital longer, and with this, we have higher risks of things like infection in the hospital. So it's important. So if you feel like your clinic could do more to support your inappetent patients, try this. Firstly, review your hospital sheets over a set period of time. It could be 2 weeks or a month. I personally would recommend a month, maybe even longer if you don't have many inpatients. So you might need like 2 months of data, for example. When you are reviewing those hospital sheets, ask yourself the following questions. Firstly, how many of these patients have clear feeding instructions? Secondly, how many can I clearly see the calorie intake that they had? And thirdly, how many consumed less than 33% of their RER for 2 or more days in the hospital? Then, once you have reviewed the current situation, ask yourself what improvements are needed, because then you can work on implementing change and then reassessing to see if that change has improved the outcomes. This is exactly what one of the nurses in the community did, and she didn't do this because she was asked to. She did it because she identified that there was a potential gap in the care that they were providing. She knew why it mattered, and she wanted to use her skills to give better care to her patients. And there is nothing stopping any of us from doing the same. And since then, I've seen other nurses do this too. This is also something that I have done in my previous clinic. And between all of us, myself included, we have seen reductions in things like in-hospital weight loss, improved patients who were meeting their RER, more patients that had clearer feeding plans, and increased numbers of things like feeding tube placement. And that feeding tube placement point in particular is something that I want to highlight because it's often an area where many veterinary nurses and technicians feel frustrated. I definitely remember many times where I felt like asking for a tube just went ignored, or feeling like I couldn't push for a tube even though I knew my patient would need one. And yes, while these decisions need to be made by our vets, they can't make those decisions if they don't have the clinical information that they need to back them up. And that is where we can use our nursing skills and our autonomy to do more. So take it upon yourself to look at what your patient is taking in, make them a feeding plan, calculate their intake, and then ask for that tube confidently, knowing that you have the data to support it. And if it's a nasal feeding tube, also ask if you can place it, because that is another important nursing skill. And that's also what I have seen more of my community do. Placing these tubes for themselves under vet direction, all because they identified a need and spoke up about it. Another important area that I've seen nurses do more with in this way is with actually anaesthesia. And even though it's not necessarily medicine, this is not an anaesthesia podcast, we know that anaesthesia is a huge part of our day-to-day role, and medical patients, just like any other, need anaesthesia and they need nursing support throughout this process. Medical patients also are not always easy to manage under GA. They are, by definition, not healthy. They have some kind of disease, often increasing things like their ASA status and bringing with it specific considerations. And while no patient undergoing an anaesthesia or anything else for that matter is cookie cutter, And no, our medical patients don't fit nicely into a set anaesthetic management protocol. There are still ways that we can use more of our skills to support them as veterinary nurses. For example, I had one nurse in my community develop, alongside their vet team, anaesthetic protocols for diabetes and Addison's disease. And if we think about these patients, these are two patient populations whose conditions carry additional anaesthetic risk and who need careful support. There are specific considerations about things like glucose management for our diabetics, and then things like steroid administration, blood pressure support, fluid therapy, electrolyte balance, etc. for our Addisonian patients. So this RVN looked at the current evidence, put together some suggestions, and went to their vet team. They worked with the vet team to create a protocol that everyone could use as a baseline, adapted of course to each individual when they were anaesthetising these patients. And now that team can use that information to approach those higher risk patients more confidently, know exactly what their patients need, and feel better equipped to handle complications if they arise. So whether it's nutrition, anaesthesia, or anything else, the principle behind improving standards is exactly the same. We need to audit what we're doing, understand what the evidence tells us to do, and advocate for change. Everything improves as a result, and this is an area that we are ideally suited to champion as nurses and technicians. This episode is brought to you by the Veterinary Internal Medicine Nursing On Demand Library Club, and honestly, if you are not already a member, then you're going to want to hear this. For just £21 a month, you get access to the entire Veterinary Internal Medicine Nursing webinar library. That is over 60 hours of CPD, and it's growing month on month on all things internal medicine nursing, and it's available on demand whenever you need it. And it doesn't stop there. Every single month you get a brand new webinar too, plus access to the monthly evidence files live sessions all included. Whether you want to deep dive into a specific topic or just keep your CPD ticking along, the Library Club makes it ridiculously easy for you to do so. There's no contract, you can cancel anytime, and if your clinic gives you a CPD budget, I can even invoice them directly for a yearly subscription. Think of it as your own personal library card for veterinary nursing education. Head to veterinaryinternalmedicinenursing.com and check out the Library Club to grab yours. The link is waiting for you in the show notes. And now, back to the episode. I also want to talk about stepping into our power as advocates for our patients and our role in clinical decision making, because this is probably the thing that makes my heart the happiest. I have seen veterinary nurses over the last few years do more and more and more with patient advocacy, and in the community, one thing that we always do is we come together to share our wins and celebrate each other. And the biggest wins that I have seen have come from people confidently advocating for their patients. And for a long time, I think many of us, myself included, didn't really feel like veterinary nurses could have a voice or ask for change, because it was mostly seen as kind of outside the scope of our role. Because sometimes we're limited by what we can do, right? If it involves diagnostics or prescription or a change in the treatment plan, if it falls outside of Schedule 3, if it's outside the legal remit of our role, our hands are tied. But even if we can't prescribe or treat or diagnose, we can discuss those things. We can advocate for our patients and we can ask for change on their behalf. And this is an area that I have seen countless nurses inside the community step into. And what I want to do is share with you just a few examples of what this has looked like with different medical patient populations. And this is across a variety of practices, including out-of-hours centres, referral centres, and general practice clinics. The first one is analgesia, and in particular, utilising CRIs and multimodal analgesic plans. Multiple nurses have discussed with their vet team about enhancing the analgesia protocols that they use for patients with acute or severe pain. This has included things like escalating intermittent methadone doses to CRIs, in particular with patients that have things like acute pancreatitis, or adding multi-agent protocols where needed with things like ketamine and lidocaine, or even utilising local blocks where they perhaps would not before. So things like sacrococcygeal epidurals for blocked cats, for example, and also even utilising dental nerve blocks ahead of procedures that are affecting the head, rhinoscopy, that sort of thing. Now, not a single nurse or technician acted outside the legal remit of their role. even though we are talking about medications here. Because what they did was observe their patients, identify a need for change, think about different ways that their patients could be supported, and then take that information to the vet to collaborate with them. And in every case, it happened. And this seems like a tiny thing, but it is an enormous win for us, for our patients, and also for our vet team, because we are in their corner helping them manage their cases. Another area that I have seen at least 8 to 9 RVNs champion is alternatives to traditional IV access, especially in patients that require longer term IV access, multiple blood samples throughout hospitalisation, or who are critically unwell. I have watched RVNs in all of these cases discuss with their vet team about things like sampling lines to preserve veins and minimise needle sticks. This has resulted in easier and more reliable IV access, increased use of Schedule 3 skills because we can place things like sampling lines under Schedule 3, easier blood draws, and more comfortable patients because ongoing venipuncture is not needed, and this has all happened because those nurses asked for it. Another area that I want to highlight here is continuous glucose monitoring. Now, unsurprisingly, with the way that diabetic monitoring has evolved over the past sort of 5 to 10 years, and also with the number of nurses in the community that are keen to champion it, we have also seen lots of RVNs advocate for the use of continuous glucose monitors. And while we do use these quite a lot for outpatient diabetics, one area that I'm excited by is watching nurses advocate for these in-house too. I have seen multiple RVNs ask for them in hospitalised DKA patients, or even complex non-ketoacidotic diabetics, where frequent monitoring is needed for multiple days. And instead of performing countless ear pricks, making patients uncomfortable and sometimes even head shy, these patients have had easier, less invasive monitoring while remaining happier in the hospital. I've also seen clinics where these devices were literally never used go and do a complete 180 and now use them all of the time, both on their inpatients and also in lieu of things like glucose curves in their outpatients as well. And that's happened all because an RVN brought the information to the team, created a proposal, created a costing for using them, and asked the question if they could. And what all of these examples have in common is that a nurse saw a need for something, understood the evidence behind a better approach, and used that knowledge to change what happened for their patient. This is not us overstepping or acting outside the legal scope of our role. We are not talking about bypassing the vet here. We are working together, working with them, with veterinary nurses and technicians contributing clinical knowledge and observations, and vets making the final call based on better information than they had before. The last area that I want to highlight is what happens when we get to use our practical skills. Now, I have scrolled back through years of community posts watching nurses share their wins, and one thing from what they've shared really stands out, and that thing is that everything gets better when we get to do more. There are countless ways that we can use more of our practical skills to enhance the care that our patients receive. If we think about where we have previously been for a second, our skills usually aren't fully applied because the opportunity hasn't come up, because we haven't felt confident enough to step forward, or because the clinic culture hasn't been one where those skills are routinely used by nurses. But this is changing. I have watched as nurses have unblocked cats under vet direction, placed nasoesophageal feeding tubes when they weren't doing this before, decided to start looking at blood smears and then took the information from that smear exam to the vet, and then set up and running transfusions all as a result of their findings and the information that they gave the veterinary surgeon, and many, many more things. And another really important area that I have seen veterinary nurses champion is in mentoring their teams. Not just taking their knowledge and doing more with it, because yes, patient care improves when we do that, but patient care improves even more when we help others do the same. So these nurses are teaching their colleagues, supporting their students, and explaining why all of this is needed with that particular patient, and then helping them achieve those same wins that they do. I firmly believe that no good comes from gatekeeping our skills and knowledge. More patients benefit when we create environments that help our colleagues ask questions, feel confident, and develop their skills. So make sure that it's not just your own skills that you're developing. make sure you are sharing that passion and that knowledge and that wisdom with the nurses around you and encouraging and supporting them to do the same. So what does all of this mean, and what are we going to do with it in our clinics right now? Well, as you know, as part of the preparation for this episode, I sat back, I looked at all of the community posts I shared, I looked at every single win that the members have shared since 2023, I looked at all of the wins they'd logged in their skills trackers, and it reinforced two things to me. Firstly, we can do a lot more than we think, we just need the opportunity to do it. And secondly, magic happens, and I truly believe magic happens when veterinary nurses get together and make change. None of what these people have done is impossible. All of these things I also do in practice, and across all 200 plus of us who have been inside that community, myself included, we have done this in a ton of different clinics, from small branches to huge specialist hospitals. All we need to do to get started is take action. Ask questions even if it feels uncomfortable. Do research and ask yourself if there's a different way of doing something out there, to use what you are learning to positively impact your patients every day. If you are in a practice where none of this is happening, where nurses aren't leading clinics or contributing to clinical decisions confidently, it just means it hasn't happened yet. It means that someone needs to go first, and that someone might as well be you. So go out there, advocate for change, do more, and remember that everything gets better when you do. If you have found the episode helpful today, don't forget to share it with a colleague, pop it in your practice WhatsApp chat, send it to your nursing team, and help them do more with their patients as well. I'd also love it if you would consider leaving a rating or review on the podcast app that you are listening to me on right now. I am on a mission this year to get the podcast in front of more people, and having good reviews and ratings really helps me do that. I'm almost at 100 5-star Spotify reviews, and I would love it if you would help me get there. Have a fantastic week. Keep going out there and doing amazing things with your patients, and I will speak to you very, very soon. Bye. If you've made it this far, then thank you so much for listening all the way to the end of the episode. And I have one more thing to ask of you before you go today. I would love to hear from you. Yes, you. I love hearing about the cases that you're seeing, the skills that you're using, and the conditions that you want to learn more about. Drop me a DM on Instagram. I'm at Vet Internal Medicine Nursing, and don't be shy. Come on over, say hello, and tell me a bit more about you. Talk to you soon.